Hi guys, my name is Megan Bowen and I'm here to teach you guys about Myasthenia Gravis. If you've never heard of it, there will be a clinical worksheet I will be passing out. If you don't have it in front of you, it should be in a link right below this posting. I also have a board game of Myasthenia Gravis, which will be played after we do the remainder of the slides. It'll be questions about what Myasthenia Gravis is, some of the symptoms, just some of the stuff that we've gone over on the slides. Painted by yours truly, of course. Here's the pictures. All right. If you haven't noticed behind me, I also have a poster board for Myasthenia Gravis. You'll see more on this in the slides later on, but for right now, you'll see the main signs and symptoms, again, painted by yours truly. So the three main signs and symptoms of Myasthenia Gravis is the drooping eyelids, double vision, or fatigue. That's why I painted this at the bottom. It's also called ptosis. So that'll probably be one of the questions on the board game, if you can remember that. And then from here on, I will just head into the presentation. What you will be seeing in front of you is the slides for Myasthenia Gravis, otherwise known as MG. Starting off with what is it? Myasthenia Gravis is a long-term neurological autoimmune disorder caused by an abnormal immune reaction or an antibody-mediated autoimmune response. The body's immune system defends attack receptors in the muscles that receive nerve impulses, causing a breakdown in the normal communication in the muscles and the nerves of the face. Since thymomas and hyperplasia are so common in people with MG, it is believed that MG antibodies are produced and react against acetylcholine receptors, triggering an abnormal autoimmune response in the thymus. It is distinctive to the site due to most cases severe symptoms of the condition such as weakness or fatigue. Next, we will be talking about the prevalence and incidence of Myasthenia Gravis. For every 100,000 people born in the U.S., around 14 to 40 of those people are or will be soon diagnosed with Myasthenia Gravis. Recently, these numbers have been consistently increasing. It is also more common in women under 40 years old or men over 60 years old to have Myasthenia Gravis in their lifetime. The main signs and symptoms of Myasthenia Gravis, otherwise known as MG, is going to be the drooping eyelids, double vision, or fatigue. You will see that on the poster board behind me later on in the recording. The first symptom is always the weakness of the eye muscle, and there is also drooping of one or both eyes usually, called ptosis. Some other signs and symptoms include blurred vision, a waddling gait, weakness of the arms and the legs, difficulty swallowing, difficulty breathing, or difficulty speaking clearly. These signs and symptoms will change based on the severity or type of Myasthenia Gravis the person may have. This condition can be diagnosed after a complete physical exam, neurological exam, and an overview of the symptoms he or she may be having. If those don't give a clear answer, a doctor can do blood tests, Tensilon tests, nerve stimulation tests, or a CT or MRI test. Some of the treatments and medical management involved are symptomatic therapy, chronic immunosuppressive therapy, immunomodulatory therapy, and a thymectomy. Since Myasthenia Gravis is mostly random, the only precaution one can take part in is to take anticholinesterase medicines about 30 minutes before meals. The reason behind this is because it will reduce the risk of aspiration. Some other precautions are taken but haven't yet been proved to prevent or affect the probability of getting Myasthenia Gravis. About 15% of patients have associated another autoimmune disease, some of the most common being the thyroid disease, which you can see pictured in the top left section of the slide, the rheumatoid arthritis, which rarely happens, but you'll see it in the picture as well, or lastly, systemic lupus erythematosus. There are 5 types of Myasthenia Gravis. 1. Congenital Myasthenia Gravis. 2. Generalized Myasthenia Gravis. 3. Ocular Myasthenia Gravis. 4. Transient neonatal Myasthenia Gravis. Or 5. Juvenile Myasthenia Gravis. 3 of those occur in children and will be discussed later on in the slides. The 3 types of MG that occur in children is the congenital myasthenia gravis, the transient neonatal myasthenia gravis, and the juvenile myasthenia gravis. I am going to be describing these along with the other types of MG in a moment, starting with congenital myasthenia gravis. Congenital MG is caused by a genetic defect. It can happen any time. It is an autosomal recessive pattern, and there is no response to treatments. Next is the generalized myasthenia gravis. It is chronic and autoimmune. It is a neuromuscular disorder. It is more severe than the other types of MG, and it causes weakness in other various muscles rather than just the face. It can spread to the body and cause extreme fatigue in people with it. It often also causes myasthenic crisis in people with MG. Next is ocular myasthenia gravis. 15% of these people have only ocular muscles affected, meaning the eyes. They most likely have ptosis in one or both of their eyes. It is more severe at the end of the day, so in the beginning or the morning, it's not as bad for them. It can be found with a sleep test, eye test, or an endophonium test. Third is the transient neonatal myasthenia gravis. Like said before, it affects children. It affects 10 to 15% of babies with mothers who have MG or have had symptoms of MG even if they weren't diagnosed. It is possibly due to an autoantibody characteristic, and babies are often struggling and hypotonic. Their likeliness to live a normal childhood depends on how the MG is treated or how severe it is. Lastly is juvenile myasthenia gravis. Rather than just children, this happens in teens as well. People with this can generally live relatively normal lives, depending on how well they take care of or treat their MG. It is autoimmune still and can be found with a blood test, electromyography test, a tensilon, or an endophonium test. It also causes thymomas from time to time. Hi, I'm Megan Bowen, and today we're going to be playing the game of Myasthenia Gravis. So, we have our players here, BJ and Josh, and this is a board game. I showed you this in the slides, and these are the rules of the game, typical sorry rules. I have already presented to them, so they should know the answers to the questions that I'm about to ask. Who wants to go first?
I will. Go on.
Okay, so first question, what does myasthenia gravis affect?
The nerves and muscles in your face.
Good job. Now you can roll your dice.
So I got a 3, so 1, 2, 3.
Okay. Next is Josh. What is 2 symptoms of myasthenia gravis?
Drooping eyes and I don't know.
So he gets it wrong. Is it
Yeah,
my
I
turn?
get
He
it
gets
wrong,
it wrong.
So then it's your turn.
So BJ gets to
There
go.
you go.
What is
It
it?
is drooping eyes and double vision.
There you go.
Good job. You get to go now.
6.
Moving along fast.
Yeah, look at that. All right.
Okay, so we're back. They played a couple rounds. BJ is winning by quite a bit, but you still have a chance to get up there. Next question is, name a treatment of myasthenia gravis.
Symptomatic therapy.
Good job. You can roll the dice. 3.
All right. Oh, there we go.
Okay. Next question is, can anyone name a related disorder of MG?
Thyroid disease.
Good job. So the game is almost over. BJ, how you feeling?
Pretty good.
You gonna win?
Yep.
You are next. So next I'm going to ask, what is a type of myasthenia gravis?
Generalized MG.
Good job. You get to roll a 5. Okay. Josh, can you name Another related disorder of MG.
I don't know.
You don't know?
No.
You're gonna lose the turn?
Yeah.
Okay, B, can you answer? You have a chance at winning.
Rheumatoid arthritis.
Rheumatoid arthritis, good job. Roll your dice. 6, he's a winner.